Well, the international scheme set up to ensure equal access to vaccines is currently 140 million doses short, and that's due to the continuing crisis in India. Now Unicef is calling for the powerful G7 countries, the leaders of which will meet in the UK next month, to share their surplus of doses. Our global health correspondent Tulip Mazumdar reports.
It's a global collaboration that's never been tried on this tight timescale before. The aim of the Covax scheme is to ensure all people in all countries get equal access to vaccines to protect them against COVID-19. Some progress is being made, but doses remain vastly unevenly distributed. And now the pipeline providing vaccines to some of the world's poorest countries is being squeezed. As India continues its devastating battle against a raging outbreak, the country's Prime Minister has temporarily banned exports of COVID-19 vaccines so that all doses can be used in country. The Serum Institute of India was due to supply around half of the 2 billion vaccines for Covax this year, but nothing's been shipped since March, leaving a shortfall of around 140 million doses, which is due to rise to 190 million by the end of June.
Unfortunately, we're in a situation where we just don't know when the next set of doses will materialize. Our hope is things will get back on track, but of course the situation in India is uncertain itself.
And how much of a concern is that?
It's certainly a huge concern, and that's why we are calling on higher income countries that have access to doses to start sharing those doses now.
But countries are not being forthcoming with donating doses. Data commissioned by Unicef suggests that the rich G7 nations, as well as the EU, could make a big dent in the vaccine deficit in poorer countries by donating 20% of their supplies in June, July and August. This would free up around 153 million doses. So far, France is the only country to have already shipped vaccines in view of the crisis in India, pledging 500,000 doses by mid-June. Nations including Rwanda, Senegal and here in Ghana are using up some of their last remaining doses.
It's very important that the global promise of solidarity for those countries that have enough vaccines to distribute and share those doses, because unless we stop the transmission everywhere, it will be very difficult to end this pandemic, even in places where people have been completed vaccinated.
New deals with different vaccine suppliers and manufacturers are also underway to try and get the Covax scheme back on track. But right now, there's a gaping hole in supplies, which is threatening the global plan to end this pandemic. Tulip Mazumdar, BBC News.